Hi, my name is Madison Wolf. I'm a fourth semester nursing student at OSU-OKC in our leadership course, and we are here to present our Pico presentation. This could be presented to hospital administration or used as in-services at hospitals for nursing staff. We chose sepsis as our overall topic, but to be more specific, we wanted to answer the question of, is early screening tools effective in our hospitalized patients and their outcomes? So just a little bit of facts about sepsis. It is the leading cause of death in patients hospitalized. 35 to 25% of our patients with sepsis do end up dying, unfortunately, and it is also very, very costly for our hospital systems. About $17 billion are spent annually fighting sepsis and treating it. So it is actually a major issue that with a simple fix could cause something to become so much better.
Hi, my name is Morgan Weaver, and I'm going to be talking about what is sepsis and what it looks like. So sepsis is a body's extreme response to an infection. It happens when an infection you already have triggers a chain reaction. So early identification is achieved more often through a multifaceted approach with nursing as the driving force for the earliest intervention. Usually it starts with the adoption of an institutional surveillance system, screening tools, and/or protocols designed to facilitate early recognition and treatment of sepsis. An adjunct to use of early screening tools, it is important for any nurse to think outside the box and listen and respond to the perceptions of patients and caregivers who can sometimes uncannily see the early signs of deterioration before others. So some signs and symptoms you're going to see: shivering, extreme pain, pale skin, sleepy, difficult to arouse, I feel like I might die, and shortness of breath.
My name is Sheridan. I am going over labs. So the diagnosis of sepsis can be difficult. The criteria for diagnosis include high or low body temperatures, fast heart rate, respiratory rate, plus a probable or known infection. There is no single test that can identify sepsis. Healthcare professionals typically order a combination of tests to help diagnose sepsis, distinguish it from other conditions, detect the inflammation associated with sepsis, and to evaluate and monitor the function of the affected person's organs, blood, oxygenation, and acid-base balance. So just some labs are a CBC, lactate, blood gases, CMP, a PT, PTT, a CRP, blood culture analysis, a sputum culture, and then the lactate labs. Inaccurate lactate results tend to stem from pre-analytic issues. For example, a difficult blood draw with prolonged tourniquet time or prolonged transport times to the lab can cause an elevated lactate acid level in this specimen, producing a false positive test result. Cold temperatures are known to slow the reduction of pyruvate to lactate in phlebotomy samples, and the storage of lactate samples prior to analysis is in wet ice is advocated as the standard of care. A gray top tube should be used. It must be put on ice and have the analysis done in 20 to 30 minutes to get accurate levels.
Hi, I'm Vera Green, and I'm going to talk about the sepsis screening tools and the 3-hour and 6-hour bundles. Sheridan kind of covered some of the labs and the vital signs that are used for this screening tool. When a patient presents, say, to the ER, if they come in with like a new upper respiratory issue like pneumonia or a productive cough with fever, that's going to be a check on their screening tool, as well as a urinary tract infection, abdominal pain, and a soft tissue injury with possible infection. So that is on A. On B is going to go over the mental status change. If they have a fever over 101 or below 96.8, their tachycardia over 90 beats per minute or 20 breaths per minute. And also if they're over the age of 65 or under the age of 2, that would also be some criteria, or if they had comorbidities such as diabetes, morbid obesity, and immunocompromised. So in the B, you have to have 2 marks in order for that to be considered sepsis criteria. And then C is organ dysfunction criteria. That's if the CBP is less than 90, the lactate is over 2, and the platelet count is less than 100,000. It also covers creatinine of less than 2, white blood cell count greater than 12 or less than 4,000. So if you have 2 or more Bs and an A, that is positive for sepsis. So then you would start with that time when they checked into the ER as time 0 to start your sepsis bundles. You would bring the patient back, hook them to a monitor, and alert the provider that they screened positive for sepsis. And then that would be in the 3-hour bundle. You're going to get your lactic acid and your blood cultures and start your IV antibiotics, but make sure that you start the IV antibiotics after you have gotten the blood cultures. Then you would do the IV fluid bolus, the 30 mils per kilogram per hour, and then start vasopressors if those are needed for hypotension. In your 6-hour bundle, you're going to get your second lactic acid within 2 hours if the lactic acid was more than 2.1. Often when it gets to that 6-hour bundle, they are already admitted to either ICU or to like a med-surg or acute care setting.
So as Farrah said, this screening is implemented at time 0, which is as soon as you hit the doors at the ED, which changes patient outcomes massively. Our research showed that 23% decrease in mortality if you do early screening and early treatment. So, and also a 15% decrease in septic shock patients in the ED with early screening. So it's very important that we use this, and especially because it is so simple, there's no reason to miss it, because early screening leads to early treatment, leads to saving lives. Thank you.
Thank you.
Thank you.